Good morning. Oh, my name is, there we go. It just popped up with something. My name is Nellie Mitchell, and I am a 2012 graduate of the College of St. Scholastica HIM program. And actually, I actually can't remember the year. I think it was 2014 that I graduated with my master's of HIM. So somewhere around there. So I was asked to talk today about my career path and just kind of about the VA in general and about being a federal employee. Um, I will tell you that I've worked in the government most of my adult life. I've been in the VA for about 11 years. And before that, I was in the Army for 4 years. So, total almost 15 years. All I know is the government, and the government talks in acronyms a lot. And so I'm making a conscious effort when I talk to you not to do that. But if I do start talking crazy, you don't understand what I'm saying. And tell me, ask me to explain what I'm saying. Um, just background, like I said, I was active duty Army from 2004 to 2008. My job was a 68 whiskey, or it's called military occupational specialty, but it was 68. Ultimate goal at that time was to become a nurse. Why I decided to enlist in the Army is kind of a whole story in itself, and maybe we'll have time for that. But as hard as it was and as crazy as it was probably one of the best decisions I've ever made in my life. But okay, so like I said, my ultimate goal was to become a nurse. And so I decided to enlist in the military. And in 2005, so right in the middle of Operation Iraqi Freedom, let me tell you how excited my mother was about that. Um, she wasn't. But so I enlisted I was in basic training in October of 2004, and I was boots on the ground in the Middle East in October, November-ish of 2005. So pretty quick. The training was excellent, but also very scary because you're like, am I ready for this? This is, it was a really crazy time. So, as a medic, I'm sure you can imagine, we saw some pretty brutal injuries on a pretty regular basis. And not just with our own people, but with local nationals and Iraqi army and Iraqi police and even the bad guys. And, we saw a lot, and we got a lot of hands-on medical care. And after that, I decided that maybe hands-on, I've had enough for my lifetime. So nursing wasn't going to be my thing anymore, but I still wanted to stay in the medical field. So I got out of the Army in 2008 and took advantage of the wonderful GI Bill and was looking for places to go and a college program to get started with the next phase of my life. And I kind of, to be honest, found the HIM program at St. Scholastica like on accident by like Googling it. Like, what else can you do in the medical field besides touching people and providing hands-on care? Because I don't want to do that anymore. And I started reading about HIM, and I'm like, this is it. This is what I'm supposed to do. I don't know exactly what in that field, but at least I still get to work in the medical field, and I can bring that experience to this somehow, some way. So like I said, I finished my bachelor's degree in 2012, sat for the RHIA exam shortly thereafter, and passed, luckily. And I finished my master's in 2014. All the while, when I was still in my undergrad, I knew I still wanted to work for the government. I still wanted to work with soldiers or veterans or do something in that field, just because that was something that meant so much to me. It's such a profound impact on my life. And lo and behold, while I was on one of my internships, I forget what they're called, professional practice something. Yeah, I did one of mine at the VA in Minneapolis. And they gave me access to their system, to their email system, and I was able to go in and do things in practice. But also, being as resourceful as I am, I stalked the people who were hiring because I had that internal source. And I found this program, and I'd heard about it through somebody else that had gone through the TCF program. That was a CSS grad too, but it's called the Technical Career Field Health Information Management Internship Program. It is an internship that is specifically meant for HIM professionals, usually newer grads or someone that has just sat for their RHA or are going to sit for their RHA or RHIT. And it's a 2-year internship that's a hands-on training. It's for HIMSS professionals. There's a whole bunch of different categories that they offer these internships in, but HIMSS is one of them because it's identified as a critically identified position. So while you're in your internship, you get salary, you get benefits, you get hands-on training, you work full-time in a VA facility, you have a formalized training plan for those 2 years. They send you all over the place if you choose to go. They give you money for education, they give you money for travel, they give you money for conferences. You go and you just do all the things for 2 years, but you're in an official position, but you're also in a trainee position. So your whole goal for those 2 years is to learn everything you can learn. And it's an amazing experience, and it's evolved over the years. And I don't know, it's been a while since I've gone through that program, but I know it's still there. And you know, now and don't quote me on this, back when I was in the program, they made you sign a mobility agreement. So when you were done with those 2 years, you would basically be sent to wherever VA needed you if your facility that hosted you didn't have a position that was open. Fortunately for me, a position became open, so I didn't have to move again. Otherwise, I was willing to, if that's what it came down to. I don't think they're doing that anymore. I think now if you're accepted in this internship program, you are offered a position at that facility. So that's really nice because moving is tough. Anyways, so we can talk more about that later because I think that's something everybody should explore. I don't know all the sites that are accepting interns yet. Usually it comes out in the spring, maybe June-ish. But I can certainly send information if people are interested because it's an excellent way to get into the VA. And it fast tracks you to higher pay and more promotion opportunities. So in the VA, I mean, it's the government. So everything in the government is FOIA-able, and all of our salaries and positions and most of that, it's all public information. So a lot of places don't talk about salary because they don't talk about your salary. We do in the government because it's all public. The tax dollars pay our salary, so it's everybody's business. So when I talk salary, if you get weirded out, that's why. It's all, you can all look it up. But when I started as a GS7. So as a TCF intern, so it was like around 45,000-ish a year. And by the time I was done with that, I was a GS11. So it's a pretty significant pay jump. That's hard to do if you're not in this internship program to get those next levels. And I'm sorry, let me back up. GS is pay scale in the government, okay? So there's GS1 through GS15, and each GS level has 10 steps, and each step is a different pay scale. So if you Google GS pay scales, you can kind of look at it, and it depends on where you live, on what you get paid. So people in Washington, D.C. at my level are going to get paid more money on paper technically, but it also costs more to live there than it does here in Madison, Wisconsin. So it all depends on where you live, but it's all once you're in that GS level, it's not, a lot of positions don't have a laddered GS, so you're just in that position and you move the steps to get a pay increase every year. To get extra GS, next GS level is usually another job or another promotion. So, but in the TCF job itself or the TCF internship, it is like mandated automatic promotions and more pay. Like you can't really go wrong there. So we'll get back into that a little bit later. So after I did my TCF internship, I got a job in research. I was working as the administrator in the research department, where our providers were mostly doing the research studies and doing clinical trials and things like that, and not so much clinical time and seeing patients a little bit. So I really got exposed to the world of IRBs and the world of VA IRBs versus, University of Wisconsin IRBs and how that whole world worked. It was really interesting. But I was trying to get back into the HIMSS, a true HIMSS area, because this was my degree. This is where I was. So I spent about 2.5 years in that position before I finally got back into another management role, overseeing all of HIMSS and all of a bunch of other things in that realm, which is I was the associate chief of patient administration services, which is in the VA is basically everything administrative. And eventually I ended up taking over as chief of patient administration. So I ran the whole show. So all eligibility that would come in, not all veterans are eligible for VA care. So I had a whole department dedicated to reviewing applications to see who's eligible and who's not, and getting them enrolled in VA care. I also have community care, or had, I should say, community care, which is anything that the VA pays for outside of the VA. We coordinated and paid all those bills. My budget was like $150 million. It was crazy. Yes, it was a big responsibility. Also, all of HIMSS, all of coding, inpatient, outpatient, CDI, release of information, scanning. I oversaw all of that. It was a big job. I had officially like 20 direct reports, but each of them had like 20. So our whole department was like 110-ish people. It was a lot. It was a big job. And I took over that job in January of 2020. So you can imagine what happened in March of 2020. COVID happened. And I'm sure everybody knows, we've all have our own stories with COVID, but working in a facility during COVID was crazy. It was like, I keep telling people it's very comparable to a deployment, because you kind of see how people react in times of like chaos. And it was empowering because a lot of people that you didn't expect to stand out as leaders really showed up and carried the rest of us through, that we're trying to carry our departments through with minimal staffing and everybody out sick. One of the things that I was responsible for during COVID was trying to procure a refrigerated truck, because in the VA, we share resources. And in our network here in Wisconsin, part of our network is the Chicago area, all the big VA hospitals in Chicago. During COVID, there were so many deaths in those hospitals that they did not have enough space. So we had to procure a refrigerated truck. The morgue was also my responsibility, so that was fun. But we had to procure a refrigerated truck in the event we had to take overflow from other sites. And this was in the beginning, when nobody knew, will dead bodies still pass this to everybody? Like, it was just crazy. So we had to plan this whole. It was a lot. Anyways, so after the 2 years of dealing with that in that position, and things started to kind of die down, I think COVID for me brought a lot of clarity, where I didn't realize, I guess, how burnt out I was in that role, and just being burnt out as a manager in general. Most of my time in the VA was as a manager. So it's a lot to be a manager. And that's all I really knew, is how to be a supervisor, And then after COVID, when, we were trying to run off of minimal staff, trying to provide the basic care and the basic functions of our job, and barely being able to sleep and working all hours of the night, it was just like, this is not something I think I want to do anymore. It was really tough for me, because I was on this path of supervisor and manager, and I got promoted pretty quickly, and this was kind of my path to go. Maybe I want to go the executive route. Maybe I want to I don't know, go up to be even a higher manager, or senior executive. And after COVID, I was like, I don't want to do that. I was like, I don't want to do that. That is not, I'm a mother. I have 3 kids. COVID was tough on kids too, but it just brought a lot of clarity to me. So I was like, I got to see what else is out there, and maybe try to do something totally different. So, making friends and networking pays off in the end, because the person that I had gone through training with a few years prior to this, I messaged her and said, hey, because she was a remote worker. I never had worked remote in my life. I'd always been in the facility. And I said, hey, I'm dying here. I need to find something else before I lose it. And do you know of anything, is your office hiring? And she said, actually, yes, we are. And so I put in my application there, and it took a year. But finally they called me. and they were like, hey, we have this really cool job, and I'll get into it. My job is really cool. I just, maybe you don't think so, but maybe I'll nerd out over it, but I think it's cool. But I got this really cool opportunity to do something totally non-traditional, off the cuff, never done anything like this in my life. And I'm like, let's do it, because I'm ready to do something just different with my life. So now that leads me to my current role, which on paper, I'm a program analyst with the Office of Academic Affiliations, and it's one of the program offices under the Veterans Health Administration. So our office, just a little about what Office of Academic Affiliation does. So we oversee one of the 4 statutory missions of the VA, which is to administer a program of education and training for healthcare personnel. So the VA has 4 statutory missions. That's one of them. One of them is to develop, maintain, and operate a national healthcare delivery system. So our hospitals, our clinics. Another is to conduct research. Research is huge in the VA. And the 4th one is provide contingency support to the Department of Defense and HHS during times of war or national emergency, which was a huge deal during COVID. That was our main priority during COVID. So basically what my department does is we oversee the second mission to administer the program of education and healthcare for America. So our mission is to educate for the nation and for the VA. And what the VA does is we partner with many academic institutions throughout the entire country. Almost, I think every VA has a partnership with an academic affiliate, is what we call them. And together, the VA and the academic affiliate work together to train our future healthcare professionals. So I don't know the exact percentage, but I think 70% of all doctors completing their residencies complete part of their residency at the VA. So because that's a lot. That's a lot of people. Because that's such a huge partnership, we have a lot of say-so in how healthcare trainees are trained. So part of, let me see here, I have some notes here. So there's actually a law that mandates this. So we will partner with the institutions and literally create an entire residency program. We have our own regulations, they have their own regulations, and together they train all the doctors to do all these things. There's money that's involved in it. There's a lot of initiatives that come out of this, and there's a lot of opportunity for people to get involved with the VA and do a lot of really amazing things at that level. So in my role, one of the biggest, I have 2 kind of major functions. And my biggest one that I'm just going to start to take over is I'm what's called a designated federal officer. And it's for the National Academic Advisory Council, or National Academic Affiliations Advisory Council. So there's like 25 advisory councils-ish in the government, and I have one of them. And the whole purpose of this is to, well, I'm an administrator, so I don't do the decision making, but I plan everything. And so what we do is we get together 4 times a year, twice face-to-face, twice virtually. And this committee will come together and make recommendations to the VA secretary on matters affecting partnerships between the VA and our academic affiliates, and how we train all healthcare professions trainees going forward. And so it's really, to be honest, I didn't realize how big of an impact this committee is until I was just in Florida. We were just in Orlando for one of our face-to-face meetings, and the people that are on the council and the decisions that are being made and the discussions are pretty substantial, that will, eventually get reported to the VA secretary, which then gets reported to the White House. So, and what will happen then is once they're all approved, is that all these recommendations that come from this council will get implemented into the VA and will make an impact on all professions, health professions, trainees in that partnership in the future. So some examples are, some of the more recent things that are in everybody's, in the news and in politics are, the subject of gender affirmation care. There's also the abortion care. And politics aside, our function in this is to train. And there's a lot of controversy right now with healthcare institutions and, do they want to continue training healthcare trainees on these, how to perform procedures or what it's about based on people's political feelings about those subjects, if that makes sense. So there's a lot of discussion saying like, well, maybe this institution doesn't want to train on reproductive care and abortion because abortion can mean a lot of things, as we know. It's not just it's a lot of things. So a lot of institutions are considering, not a lot, some are considering not teaching that anymore based on those views. And whereas the government has a stance on we train everything, regardless of the politics aside. People need to know these for training purposes to treat people the best way they can. And there's a lot of politics involved in that right now. So it's really interesting to see, what's going to happen. What are the recommendations that will come from this, and how will that affect the politics going forward? So it's really an interesting territory. And for us as government officials, we don't comment on any of the politics. We just sit back and and guide the conversations to be within the scope of our meeting. But it's really involved in the politics more than I ever expected. And it's really interesting to see it from kind of an outsider. I mean, again, I'm not a lobbyist. I'm not a politician. I work for the government, so I can't be any of those things. But to see the government working at this level where you're right kind of in it, and how those decisions are made, and how things that are happening at other medical institutions really affect everybody. So it's really political, and it's really interesting, but it's really cool to work at a level of the government where you can see how these changes and discussions happen at such a high level. Yes, Madonna?
How deeply are you impacted, Nellie, or is your group impacted by changes in who's in the White House at the time?
All the time.
Okay.
All the time. Yep. Yeah, it's every administration has a new focus. And like this current administration has a lot of focuses. One of the biggest things that we see on our level is diversity, equity, and inclusion. And it is literally at the forefront of everything that we do. So our committee is mandated to, this is just an example, but like our committee is mandated to, with its membership, represent the same percentages of diversity as best we can as the military. So I don't know the exact percentages off the top of my head, but like, I think the military is like X percent, Caucasian, X percent African American, X percent Hispanic. We have to have that on our council as well. So when we are recruiting for some individuals, we have to make sure that we're representing we can only have 14 members. And members, they can only be on the council for 3 years with 1 3-year extension at the most. And we're rotating constantly. And when they rotate off the council, we have to make sure that when we recruit, we have to keep in mind the demographics of those individuals. So we make sure that we're representing this very specifically on our council, and that gets reported up to the secretary like regularly, and they look at it regularly. So as they should, and DEI is such a huge focus in the VA right now, where maybe in the past administrations hasn't, and it's been more I don't know how to say this in a I'm not trying to sound political, but in the past administration there was a lot of drain the swamp mentality. I don't know how to say it any better way, but it was as a federal employee, it was interesting because you saw a lot of it was focused on making sure we get the highly paid people out of highly paid positions that aren't doing their job, whereas now it's trying to make things, that's not a focus anymore. It's more like, let's make sure everybody's inclusive. So it's just all opposite, you name it. So when this next administration, whoever that may be, come in, and maybe it'll be the same one, maybe it'll be something different, but it's always something different. And one of the things I will say, when Trump was president, one of the things he did as a man that made my life easier as a manager is he created this law that was I I can't remember the name of it, but it basically made it easier to remove individuals for not doing their jobs in the government. So as a manager, it's very difficult to fire people in general. In the government, it's even harder. And so they made some laws that made it easier for us to get rid of those that maybe weren't cutting it and we just weren't able to send them along. When he was out of office and this new office came in, that law was re-looked at again by the new administration and their attorneys, and they determined that that law was unconstitutional. So people that were removed under that law in the past were getting phone calls saying, "Hey, you want your job back?" Because we had to give them all back. So that's this kind of stuff that you see. Like it's really just kind of all over the place with that. So yes, long story short, it changes all the time with all administrators. Our VA secretary right now he's actually from Minnesota. I think he went to St. John's. Dr. McDonough, Dennis McDonough. Yeah, so he's very veteran centric, which is really nice, and fights regularly, for veterans and their, all kinds of different realms. But that isn't always the case. And you can see too, in the past, at any time the president can remove the secretary and send somebody else in, and that happens too. So it just kind of sends us all into, okay, here we go. What happens now? So we are the executive branch of the government. So we technically report to the president that's under that branch. So, it's very political. Sometimes it can be annoying. I'm not going to lie. The bureaucracy can be silly and some of the rules just make no sense, but it's also so interesting to see how our government works at this level, and just being at home and just kind of soaking it all in without being involved in the actual politics itself. It's super interesting. So another part of my job that I do is this is a stretch assignment, to say the least, but I manage 2 national awards. So we give awards out to those who are doing great things in the world of health professions training education. So this is not just doctors residencies, this is health professions training all across the board. So that is where it's more of like a project manager type job. It's nothing I've ever done before. I can't tell you if I enjoy it yet or not, to be honest. But it's rewarding because the people that were, and eventually these people are going to, we're gonna have some winners of awards that win a significant amount of money. And this is one of the awards, is one of the most prestigious in the world of, academics in the VA. So it's a big deal. It's very in your face. It's very out there. I am by nature pretty introverted. I like to be at home and in the background doing things. So it's tough for me to be out there like this. It's dealing with a lot of very powerful people with a lot of questions, a lot of opinions. There's really nobody telling me how to do it. So that's a little intimidating. It's nice in a way, but there's also like, am I doing this right? Like, is this, I don't know. We're just kind of rolling with it. So far, so good, but we're kind of in the midst of that. This is the first year I've done anything like that before. Actually, this is the first year I've done anything in these politics as well. So like, I've been in this new role for about a year. I'm still very new. It's very humbling to start over in a way, to do something totally new, because it kind of went from being at the top of my department and knowing all the things to knowing pretty much nothing, and kind of just taking it in as we go. It's very working. I mean, our office is 100% remote. So everybody on my team, one person's in Seattle, one person's in Charleston, one person's in Missouri. We're trying to hire another person. I don't know where they'll come from. We're scattered all over the United States. And so it's very autonomous. So everything you do is kind of just on your own. We have a great team support. We have a great boss, but overall, like all the projects, all the things you do are kind of on your own. So that's it was hard to get used to be honest. Not that I had somebody hovering telling me what to do before, but we have at the hospital, there's very strict directives and very strict rules and very strict regulations, where there are here too, but you're at home. So you can kind of just like you got to make your own schedule and make your own, like, it's very, you think you were good at time management before, you're not until you work at home, because you can't, like, it's really hard to get used to. But it is, I don't know why I waited so long, to be honest. Working at home is the greatest thing I've ever done, ever. Like, and I coming from 10 years in a hospital, I see somebody nodding. Yes, it is amazing. Like, like I said, I'm a mom, so I have 3 kids and a husband and 2 dogs, and I was never seeing them before. Like, literally, my kids were in daycare for 10 hours a day at least, and now I'm home, and now we don't have daycare at all anymore, and they're in school now, so it's, a little bit different. But I mean, it's like the work-life balance that comes with working from home is a game changer. And that was, I think I'm part of I don't know what you call it, the group of people that kind of all transitioned to working from home. A lot of people left the in-person, and I was part of that group. And in fact, we do a lot of we had a contract at one point that did a lot of studies on the workforce in general and why we can't hire people, because it's so hard to hire people. And a lot of it is based off of the work-life balance thing. And and this is just my opinion, of course. I don't know what the whole world is everybody has their own experience with this, but the whole workforce has shifted so much from COVID, and where it's become really like an employee, not manager driven world, where people are kind of standing up to be like, hey, we work too much, and we have families, and we have things we want to do, and we can't do all of this. Like, there has to be more to us. And it's really just a great opportunity now for everybody. And I keep telling people this, and people look at me like I'm nuts, but when you're applying for jobs, they're not just looking for something like in you're looking for something in them. So it's the same type of interview. If you're going to be rolling into a job and they're like, oh yeah, you'll be expected to answer the phone at all times of the night, you'll be expected to be online at all hours of the night. I had a job like that. That's not okay. And it's tough to make that jump to be like, no, like we there has to be more to life than just working, right? And so I think I'm part of that group. It's called it's the great resignation. So I'm part of that group in a way. And it's really interesting to see the switch from being, a manager for so many years to now being not a manager anymore, which is great also, but to just be on the opposite side of things and try to, it's really interesting. It's a really interesting time in the workforce. But I think as an employee, it's an advantage, because now there's a lot of jobs out there. There are a lot of jobs that are available. And as new grads, you can kind of take your pick. I think you can be picky. I think you can decide, it's not just, I mean, yeah, you want to make money, and yeah, you want to make a living, but you also don't want to like hate your job, and you don't want to like dread going in there. And when it gets to that point, it's literally like, I was there, and now that I'm not there, and I'm kind of in this new energized, like finding a new purpose kind of thing. I reflect back on that a lot. And it's just like, if I can give any advice to anybody now, it's just like, you interview these employers as much as they're interviewing you, because there's a lot that your happiness is worth way more than a paycheck. You know, it is. And making a lot of money is great, but it comes with, if it comes at a cost of your family or your own personal happiness, it's just not worth it. So, I think sometimes, will I ever go back to working in a hospital, or like, where do I go from here? I think I'm a pretty young professional still. I still got a lot of years left in me. Where do I go from here? And I don't know. But I can tell you that I don't know if I could ever leave my home space now. For sure. I've talked a lot. Does anybody have any questions? I feel like I've just been yep.
No, what kind of dogs do you have?
Huh?
What kind of dogs do you have?
I have 2 dachshunds.
Cute.
Oh yeah, well, one is cute. One was our COVID purchase. Everybody either had a baby or had a dog. I'm like, we're not having any more babies, so maybe we'll just get a puppy. And we should have thought about that one better. But They keep us busy, very busy.
Nellie, I was thinking about, you know, I mean, all the great things that come with having a job with the VA, with the benefits and, you know, all of those things that you've been talking about. But when you were at the point where you were looking for something different, did you ever consider leaving the VA and looking for something in, you know, outside of the VA?
No.
Hmm.
And I don't know why. I think part of it is because a few years ago, I don't even know how many years ago it was now. A few years ago, I was considering leaving the VA, and I applied for one of the I don't even know what position it was. It was a position in HIMSS or something at the university. And for me at the time, the pay cut was so significant that I kind of have it in my head now that I don't know if I'm even marketable to the outside world, just because I've only worked for the government. I only know the government. I only know the VA. I only know
Hmm.
bureaucracies and all the things. Like, I don't know how it works. Aside from like having the internships and having some meetings over at the university and things like that, internships during like my undergrad, I don't have a lot of experience with the private sector. Um, enough to where I would be able to just walk in and just get it.
Hmm.
So I don't know.
Yeah, I was
So
just curious.
yeah, no, I had it in my head that I'm like, well, maybe this is where I'm gonna make the most money, you know, and be the
Hmm.
happiest. And that's kind of where I'm at right now. I was fortunate when I left my last job and took this job that it wasn't a pay cut. So you know, it's been a
Hmm.
good for me that way. But from here, you know, of course, you know, eventually at some point, and maybe I won't, I don't know. Right now I'm happy where I'm at, which is really nice because I kind of felt the last in a hospital facility, and maybe this is just how I felt, but there's always everybody's competing for jobs there. And as it should be, you know, and sometimes you would get that, you know, I'm never going to be the person that's going to do it the wrong way. You know, I'm going to throw my hat in the circle. And if I'm not the one that's chosen, if I'm not the one that's decided that I'm the best, then so be it. Then maybe it just wasn't for me. But that's not the way that everybody rolled sometimes. And I just
Hmm.
don't agree with that. And so I felt for the longest time that even though I made fast track promotions and I was lucky that way, I felt like people were waiting. You know what I mean? And
Mm.
I was constantly having to just fight my way into positions and fight my way. And I didn't want to do that anymore. It just got to be exhausting. And I'm glad I did it because I wouldn't be where I'm at now. But I don't know.
Hmm.
It just got to be to the point where it's just, it was a really good move. It was
Good.
a leap of faith. Let me tell you. So like, if this doesn't work, what am I going to do?
Yeah.
But it's been a year now, and so far so good. You know, I have
Okay.
my mid-year review next or tomorrow, so I guess we'll see.
Okay. Thank you.
Yeah. So I don't know if anybody's interested in working in the VA. I can tell you, you know, if you are, now is the time to really kind of dig into it. Um, the VA is struggling just like the rest of the world with hiring people, and because of that, they've come out with a lot more initiatives and a lot more things to try to be competitive with the outside world, because historically, not always, but sometimes the VA, I think more on the doctor level, is not really comparable to the outside sector. Maybe the VA pays a little less. I don't know about administrators though. I would argue that I think we have a pretty good, you know, fight in that. But they're offering a lot of different initiatives for people that are applying. So sign-on bonuses, you name it. Sometimes they'll offer relocation, so they'll pay for you to move. You have a lot of uh, power, I guess, at your hands as somebody seeking a position to negotiate that. Where in the past, it's not always easy to negotiate additional salary in the VA because it's so regulated. Every dollar that's spent in the VA is very regulated. Clearly, it's our tax dollars, right? So we don't want waste, we don't want fraud, we don't want abuse, we don't want people doing dumb things. And so, you know, it to be able to negotiate more pay was really difficult, because if you didn't have specific tangible evidence that you meet the requirements to at this level to make this pay, you're not going to get it. So now there's a little more flexibility in that, where they're allowing retention bonuses and recruitment bonuses and things like that. So, you know, if I was a new grad, I would definitely just see what's out there. You know, usajobs.gov is where all the jobs are for the federal government. They're getting better at making their website a little more user friendly. Now they have it where you can search remote jobs, like solely remote jobs, if that's what you're interested in. And it's not just VA, it's across all of the government. It can be, you know, Department of Defense, Department of the Army, it could be anything. But it's all there. And each job has its own set of requirements. And the biggest thing, so when you're applying for jobs in the government, you know, we're always taught, you know, with our resumes that, you know, make it short, make it succinct. In the VA, you don't do that. In the government, you do not do that. I don't know. I haven't done my resume in about a year, but I think my resume is like 19 pages long. Yeah. Because, and there's a reason behind that, because it's one thing to qualify you for the job, but it's another thing to put specific examples of the experience, what they're requiring, because those specific examples is what they will take to determine your pay. So the more detail you put in there, the better chances you are you're going to get a higher paying job. You know, there's a lot of requirements. I mean, each job will have its own set of requirements, but really the resume is the biggest thing. Like right now I'm on a resume review committee, and I think they're trying to kill me, to be honest, because they gave me 106 resumes to review, and each resume is like 19 pages, which is, yeah, no, by Friday, which will be fun. But so I know what I'll be doing this week. But that's what's going to make me, you know, be like, oh, this person is this person is this. Those specific examples are what's going to make me score somebody higher and get you through to the next round versus, you know what I'm saying? So, you know, the VA also has its own like HR software that will scan your resume for those keywords. I don't think that really works, to be honest. I don't know, because I have 106 resumes to review, so I don't know how well that worked last time. But those, taking that explicit language that's from the USA Jobs site and putting it explicitly in your resume is what's going to get you noticed. So you know, it's one of those things, like every job has its own requirements, so it's hard to give like a general tip on how you're applying for government jobs. But another thing too, networking. So if there should be somebody from the VA on every state association. So I don't know if the Minnesota AHIMA has one or not. I think I don't know if there's any besides just the people that I know and me in our department, but I'm trying to like infiltrate that a little bit, not because I want to hire people because I'm not in that capacity anymore, but I think it's important that the VA has a hand in a lot of these things that are said, because there's a lot of things happening that we can learn from other people. You know, the VA is usually behind, especially with electronics and technology, the rest of the world. So it's really, I'm like, it's crazy to me that more people aren't involved in that, in getting, you know, more information from people who have been through like implementing a new EHR. Another thing I forgot to mention, that the VA is it's a huge deal. The VA is changing from its ancient EHR, which is called CPRS. I don't even remember what that stands for. And Vista, which is the old blue screen DOS system that we still use. But they are actually going to be implementing Cerner into all VAs nationwide. This is a huge undertaking, and the problems that are arising from it right now are huge. There's no doubt that the VA needs to be modernized, and that's one of the things that every secretary that's come in, like, we need to modernize, and they're doing better, and we're getting there, but the EHR part of it is really difficult. You know, the VA has its own, like I said, there's so many regulations for everything, but the VA historically for records retention was lifetime, right? So a person's records, there's a cave somewhere in Missouri, or I don't know, that stores all of this stuff that's full, right? So the VA is trying to like, okay, well, maybe we won't send stuff there anymore. Maybe we'll just scan it in. Well, that takes a lot of space too. So now there's most places don't have actual records rooms anymore. Most of it is all electronic, but we have this huge legacy system that stores all of this stuff. So you're somebody's entire lifetime worth of medical records. How are they going to implement this brand new record without, you can't get rid of these systems? There's no way that we can get rid of all of that historical documentation, or can we? I don't know. So now it's this interoperability thing where people are like, are we going to be working out of 3 systems? Are we going to be working out of more systems? Because there's other systems that the VA used for, I mean, it could be for anything, for oncology, for infusion, for you name it. There's all kinds of different systems that feed into your system and are interfaced in there, but those interfaces are only built for CPRS, right? And into the old system. So how are they going to build all these new interfaces to make these, make it this functioning? And it's tough. There's a lot of politics around that as well. Some people are saying pull the plug, don't do it. Some people are saying we got to keep doing it. We've already spent, I don't even know how much money, billions of dollars, I'm sure, on implementing this, and it's not even implemented across all of the entire nation. It's only in, I think, maybe 3 or 4 sites total.
Wow. I was wondering like how far they've gotten. Where do you think the main issue lies then, Nellie? Is it just?
It's, I don't know. I see that there's a lot of, I think people were upset that Cerner was the one who won the contract or the bid. But I think Cerner is used by the Department of Defense also. So they were like, well, that's the reasoning. I don't really know. That was way beyond like what I was involved in. But, I think there's been some issues keeping leadership in that role because of it's such a hot spot that people are like when or they get removed. I think there's a lot of disdain that when the contract was written, a lot of this is just what I was hearing in Orlando, but a lot of they didn't come to the field to ask how this works in the field. It was done at a higher level, which is typical PA. I think it's typical in a lot of corporate places. But it's such a profound impact. I think, I think the first site that went live was out in Portland, or maybe Seattle, I can't remember. And they had this major catastrophic issue where I don't know if it transposed information. So it was like the person's name and with the wrong info.
Oh no.
Or something where they didn't have access to any records at all. Like it was just this huge, huge catastrophic issue that almost like stopped operations, which you can't do that, right? Like there's a lot of issues with it. I don't know what's going to come of it. I don't know. And I don't know.
So is it fully live in those sites that have it, those 3 sites or whatever?
I want to say yes, but I'm going to say kind of, because I think as a workaround, and I don't know for sure, but I think people are probably still using our old systems because they're like, we can't get this to work. Like, nothing works, nothing, like even as simple as scanning a medication, if that interface isn't built, you can't scan it into nothing to give. So it's Madison is set to go live, I think next year with Cerner. And part of me is kind of sad that I'm not going to be involved in that because it's kind of you don't get to see in your career really. But also, it is what it is. But it's going to be, I wouldn't be surprised if this just continually gets delayed and delayed and delayed. From a contractual issue, I don't know. The contract only lasts for implementation, only lasts a certain period of time. So I wouldn't be surprised if we were coming close to that end period. And then where's the support? Like it's a huge, huge undertaking. And there's a lot of issues with it. So we really don't know what's going to happen. I hear things at this level. I hear things from the facility level. I don't know, ultimately it'll be, I don't know, somebody will decide something at some point, but it's just a constant battle. There's legislation and there's, senators coming to the table saying, you have to stop this. You have to stop this. And it's like, that whole department, it's called EHRMIO, Electronic Health Record Management Information Office. I think it's that office is rebranded like 3 times. I think they're constantly hiring. If you want to get into the Cerner stuff, there you go. Very high paying jobs, but a lot.
Wow.
Yeah, it's I know people that have left the hospital to go work in that realm, and it's interesting. But it's just like constant standby.
Yeah.
So we'll see. At this point, the CPRS and Vista are ugly and they don't do all the pretty things, but they're extremely functional. And, that's all that we really care about at this point. I mean, especially as, veterans. As a veteran myself, I get my care at the VA, part of it. And I can tell you that it's probably the best care I've ever had in my life. It's just so specific and so personal, but there's also a lot of bureaucracy that comes with it. So sometimes as a veteran, you're kind of like, I pick and choose what I get done at the VA, and I have my own health insurance for other things. So I'm lucky in that way. But it's fantastic care. It's yes, it's the government. Yes, there's been some things that have happened in the VA in the past that have been not great. I'm sure everybody is aware of what happened back in, I don't even know if it was like 2015-ish with the secret lists in Phoenix. A lot has happened from that. Huge things have happened from that, good things and bad things. But it's the VA is really working hard on being transparent. They should be. I mean, we're the government. Everybody should, within reason, of course. But it's, the government, I don't know any better. Like I said, I've never really worked outside of the government, but I really can't picture myself anywhere else. And even though now I'm not, working directly with veterans anymore like I used to, you still see an impact of what you do, even if it's like I'm an administrator, I'm not giving care and I'm not making these big decisions, but you see, being able to have a hand in a part of such a big impact, especially for, on an education level. It's really just a cool thing to be a part of, and you get that job satisfaction that like maybe I just didn't really have any that I thought I had. It's incredible. It's cool.
Do you guys have any questions for Nellie?
Are you guys all like remote? Everybody remote all the time?
No. Today we're remote because we had,
Yeah.
just you and Brianna Shuffle as our guest speakers. So let them off the hook. They didn't have to come into class today.
Nice.
Yeah.
Sleeping in your jammies. It's another thing great about working from home. I am not in my robe today, but most days, hair's up in a pony. I'm in my robe. We all meet like face to face. Actually, it's funny when we have big meetings, like virtual meetings, where all of us will have like blazers on and whatever from here up. But at the end of the meeting, we all meet and we're like, okay, unless you don't have pants on, everybody stand up and show what you're wearing. It's so funny because everybody, like, I'll have my blazer on and like I have like these pink jammy pants that have flamingos on them, and another girl wearing like red sweatpants with like these floppy slippers. Like, it's so funny. But it's a totally different, never in my life, but it's fantastic.
Yeah, I enjoy working from home too.
Yes.
Yeah.
Yes.
All right. Could you just quickly share the name of that internship program again, Nellie? I was going to write it down and share it with my online students.
Yep, it's called the Technical Career Field, TCF. It's the HIM internship through the VA.
Okay.
And I'll look to see. I don't know. I used to be on the big group for HIMSS, but I don't think I am anymore. So I'll see if I can get a list, or if there's anything that's out there yet of places that are accepting interns. Not every VA accepts interns.
Right.
You have to apply as a preceptor, get accepted, and all of that. So I know Madison is looking into it. I don't know if they're going to do it this year. I'm good friends with the HIMSS chief, so I can text her and ask if they're still looking at that. I know that's something, maybe not this first year, she just, started this position, but maybe next year.
Mhm.
The VA loves students, the VA loves interns.
Yeah.
And it's kind of a win-win. I mean, you still get paid as a normal employee, not as an intern pay, and
Mhm.
a job out of the deal, and the VA gets a homegrown trained person.
Right.
Also, like, you can't really go wrong with that.
Yeah. Yep. Wonderful. I don't know if we've had anybody take advantage of it since you went through it, but
I remember her name. There was somebody who was a TCF intern in Minneapolis.
Madonna,
Stephanie?
Stephanie?
Does that ring a bell? What color?
I think she was blonde.
No, I'm thinking of Stephanie Roots is the one I'm thinking of that went through, but that was quite a while ago.
Mhm.
This would have been like maybe 2011-ish.
Okay.
Yeah, I don't remember her name, but
Yeah.
she's the one that, like, I talked to about it, who was like, yes. And I, when I was doing my internships, I actually got a list of all the places that were hiring, and I emailed every single one of them. And I emailed them my resume, and I emailed them my cover letter, and I'm like, remember this face. I'll be applying for this very soon. And I applied to every single one. I applied to every single one. And
Good.
I was hoping, I wanted to get into St. Cloud because it was closer to home,
Mhm.
but I didn't get into that one. Madison was my second choice, so I was like, done. But I was ready to go. We were either going to go to the Midwest or to the mountains or to the coast. Like, I didn't care.
Yeah.
And
Yeah.
luckily, I'm somewhat close to home. But yeah,
Right.
it's a great opportunity. I highly, highly, highly recommend it. I couldn't recommend it any further. Seriously.
Great. Okay. I want to be respectful of Nellie's time. Any last questions? We have 3 minutes left.
If anybody has any questions that you don't want to ask in front of the group, I mean, Katie, please share my email.
Okay.
I'm happy to answer any questions. There's no such thing as dumb questions.
Mhm.
Seriously. I was a non-traditional student and I didn't know anything. And so I just asked all the questions. It really does help. If you don't know what you want to do yet, that's okay too.
Mhm.
But it's always good to listen to people's paths and kind of see what else is out there,
Right.
because traditional hymns was just, and no offense to anybody that worked in that realm, but that was just not my thing. It wasn't for me. And I never worked in that, and I was still able to kind of find my way. So still finding my way, but a good one for now.
Oh, well, Nellie, thank you so much for your time this morning and for sharing with all of us. We really appreciate it.
Of course.
All right.
Thank you.
Good
Thanks,
day.
everyone.
Thank
Yep.
you.
See you later. Bye.